maybe 9 years. And then I got out and I became a police officer. Did that for 30 years. But nothing takes the cake when the unexpected happens and you start feeling funny and you go into it and you find out you got cancer.
Most patients, before they come to us, there's not a plan yet, and that is a time of high stress and anxiety.
I was always somebody that when I was at work, I knew what to do because I was trained, but in cancer, what do? You're lost.
The National Community Cancer Center pilot program is unique. It's given community cancer centers a chance for the first time to break through the glass ceiling of what their capabilities were. It's basically said, we want you to enroll patients on clinical trials, we want you to do outreach in the communities and help minority populations, and we do want you to do some of what we call translational research right there in your community.
It can be very challenging for patients and families to have to go to big cancer centers to receive clinical trials, for example. The NCCCP project has allowed us to offer more clinical trials within a community setting.
If you think about the way a patient has to navigate their journey through cancer, they're interacting with doctors' offices, different hospitals, different testing centers, and then of course the different physicians themselves. The nurse coordinator provides the patient and the family one person who is the focus of all of their care.
As a navigator, I'll call the patient, and one of my first questions to most patients is, what led you to get this referral to our physicians here? And tell me your story. My dad was diagnosed with pancreatic cancer in June of 2005. Now that I'm working as a nurse navigator, there's probably not a day that doesn't go by that I don't think about that personal experience and feeling like I was on my own. I do remind myself pretty much every day the importance of what I do, because I've been through it personally without a navigator.
We have something called a multidisciplinary case conference. It's a conference that meets every single week, and in that conference are all the specialists, the medical oncologists, the radiation oncologists, the surgeons. We also have our pathologist, the pulmonologist, the gastroenterologist, all the doctors who would be doing your evaluation and who would be doing your treatment, all come together in the room. At the end of that discussion, the nurse reminds us, okay guys, you need to come up now with a consensus statement. So what is the decision? Are we giving chemo first, radiation first, or surgery? And we make that decision, she gets that in the minutes, and then we as a team move on to the next patient. And the patients get a real good sense that I really now have a team that's behind me.
It was like they grab your hand and shake your hand and put I got your hand in and they put your other hand on you and how you doing? I'm Dr. Krasna, it's good to see you. I'm Maria. And they hug you. We're very lucky to have these facilities here. And to me, I was lucky because I'm not that far from here. Without her, my wife, the way she was great about this, and Maria and the people here, it's hard to get through.
A patient, they want to know, is there a chance for cure? Or is this going to be something that can't be cured and is going to be controlled with treatment?
If we always keep the patient at the center of our decision about why we're doing this treatment, the patient's always going to get the best care.
And then when you come back for your checkups and all that, and everybody sees you and they remember you and they smile, you know, because they know they say, hey, we helped this man. So I plan on living to be 98. At least. That's what I'm going to do.